Well, thank you for being here this morning. Salt Lake City is excited to be partnering with Volunteers of America on this new initiative, which will help create stability in the lives of those in need in our community. On Friday, I signed a proclamation declaring April Fair Housing Month in Salt Lake City. So it is truly wonderful that we can launch this program this month. As part of our fair housing, it is critical for cities and our partners to consider the housing needs of those with disabilities, including those with mental illness, who are often unfairly stigmatized and forgotten. VOA has been helping individuals living with mental illness through their ACT program for years. The results are incredible. Reduced costs for health service providers, less disruption in care for clients, less emergency room usage, less institutionalization, and better lives for the people they serve. I will let Kathy Bray tell you about the program, but what I will say is the ACT program is exactly the type of program the city is looking for, because it allows us to maximize city dollars while increasing outcomes. Thanks to the residents of Salt Lake City who supported the Funding Our Future Sales Tax Initiative, we are able to provide the VOA with $112,000 this fiscal year, with the goal of providing 30 individuals housing. One of the great things about having the Funding Our Future dollars, with a focus on housing, transit, public safety, and road repair, is the flexibility it gives us to fill holes when we find them, all the different types. And when it comes to housing stabilization, we find them. Cracks which people often fall into unexpectedly. The federal dollars we use to provide housing services to individuals, particularly those with disabilities, often come with a great deal of administration and requirements. They also come with long waiting lists, which simply doesn't work when someone is in crisis. With the funding the city is providing the VOA to launch the ACT housing program, service providers will be able to fill a gap in their treatment. Now individuals in this program can not only get the counseling they need, but can get the housing assistance as well. And we know that housing stability is a critical component for success. Success in keeping those with mental illness on the path to stability. Since Salt Lake City launched our housing plan, Growing SLC, in 2017, we have been looking for solutions to address every facet of our housing crisis. We have in the pipeline 25 affordable units. We are partnering with agencies like never before to get programs like this one with the funding that is necessary. Just a few weeks ago, we launched the shared housing program with the Road Home, which will help house 40 to 50 people in 2019. Next week, we will launch another innovative program with the school district to help stabilize approximately 12 students and their families who are facing homelessness. We are delivering on the promise we have made to the residents of Salt Lake City to tackle this crisis head on and to bring hope to the lives of those in need. Thank you.
Hi, I'm Kathy Bray. I'm the President and CEO for Volunteers of America, and I'm so pleased to be here. And I want to thank Salt Lake City for stepping forward a new housing partnership that'll really help eliminate barriers for people who are struggling with mental illness in particular. The ACT program is going to be the program that partners with these Salt Lake City funds. That stands for Assertive Community Treatment. And it's assertive in the way that we don't give up on people. We keep trying and do whatever we can to approach people in a way that will eliminate barriers and help them move toward health and self-reliance. And the money from Salt Lake City is going to make it possible for us to eliminate barriers like application fees. You know that people have to apply for multiple apartments. Now they have money, we have money to support them in that endeavor. What if they have utility bills that they owe from a previous apartment? We can help eliminate that barrier and move them into community partner housing with our support. So we can move people into community housing with the support from our ACT team and the support from Salt Lake City funding. So it's great. And the Assertive Community Treatment Team is helping to keep people out of hospitals and institutions, helping them to live safe and in the community. These are individuals who have fixed incomes. They have disabling conditions that are severe enough that they are not working typically, and they have disability income, and that's not a lot of money. So it's great that we have this extra funding. It'll help pay the housing related fees so they can use the cash that they do have for food and other necessities. So we're just thrilled that we have this new partnership with Salt Lake City. It's going to make a huge difference to help people get into housing, and then they don't have to worry quite as much about how are they going to make their fixed income stretch to meet all of their needs. So we thank Salt Lake City, and we look forward to the partnership in housing people with mental health issues. Thank you so much.
I'm Andrew Johnston. I'm the Vice President of Program Operations for Volunteers of America, Utah. My night job, though, is with the Salt Lake City Council. I represent the West Side, District 2 of Glendale and Poplar Grove in the Fair Park area. My job in the City Council, because it conflicts with this sometimes, means I don't partake in the decision-making process for this funding. But I am very, very thankful and proud of the mayor, of her administration, the staff who are here right now, my colleagues in the City Council for advocating for and getting this funding to help with these gaps in our housing system. It means a tremendous amount. And I want to point out here Sarah DeHaan and Larry Mullen standing here on the ACT team. I've worked with them for a number of years now. They worked with the ACT team. They're tremendous. They do a tremendous service in this community. They're experts in working with folks who have significant barriers to obtaining and maintaining housing. And they do a tremendous job of helping them to do that. Now, most, if not all, of the people who will be able to use this funding in this housing project will be Medicaid eligible. And there's been a lot of discussion through the Medicaid decision-making process to expand in the state with the waiver about the cost. And it is expensive. This is a need that's gone unmet for a long, long time. And there are a lot of people who have deep and serious medical needs that this will help. But housing in this capacity is a win-win. And I say that because we know that when people are housed and stably housed for long periods of time, their medical costs go down. It's much easier to maintain chronic conditions and not have them get worse. It's much easier to avoid serious medical complications later on. And so when we invest money in housing up front like this, it actually decreases our Medicaid costs long term. So as I talk to my colleagues, both on cities and counties and the state, I encourage them, and I encourage everyone listening, to advocate for housing. Advocate for housing because it saves us money across our system. It's the right thing to do, but it also is financially sustainable and feasible for us. So I want to thank again the mayor, the citizens of Salt Lake City, my city council members, and all the staff who are here for all their hard work to make this possible, and for all the good work that will happen because of it. Thank you.